Hello everyone, thank you and welcome to the Man vs. Time webinar. My name is Miao Lee from Manulife Financial Advisors and I will be your moderator today. So today we have Dr. Chester from DTAP Medical Group. Dr. Chester has worked in various major hospitals like the National University Hospital, Singapore General Hospital, and also has extensive experience in the primary care sector. So Dr. Chester believes in holistic care individualized to each patient and constantly updates himself with the latest in evidence-based medicine through seminars, journals, and conferences. He believes that keeping up to date is essential to provide the best care for his patients. So we also have Dr. Jonathan with us today. Dr. Jonathan is trained across a wide range of specialty disciplines. He has a keen interest in family medicine and he has worked in one of Singapore's busiest polyclinics where he has gained invaluable experience across all aspects of primary care. As a recognition of his exemplary contributions and service, Dr. Jonathan was awarded the National University Polyclinic Star Award in 2018. He also has a distinguished academic record, having garnered several accolades throughout his career. So his special interests are men's health, sexually transmitted infections, and chronic disease management. So Dr. Jonathan adopts a holistic, patient-centric approach and believes that every patient should receive care catered to their specific needs. So we have with the next slide, which is the agenda for today. We are looking forward to an interactive session with 2 Q&A segments. We will pause for questions in the middle if there are any. Otherwise, we will answer your questions at the end of the webinar. We also like to remind you on how you can post your questions to our doctors using the Q&A button at the bottom of the screen. You can input your questions as the doctors are presenting. If you would like to send your questions anonymously, this is how you can do it. Before we begin, let's welcome Mr. Wong Sweeter, Manulife Financial Advisor Chief Cluster Officer, to give the opening message. Mr. Wong, please.
Good evening, and thank you for attending tonight's event. Special thanks to our ladies attendees for taking the effort and time to understand us men better. I always believe women occupy a central figure in the family, and men should see you as a role model to help us embark on life's healthier options. Tonight's event will not be possible without the support of Bayer, Dr. Chester, Dr. Jonathan, and my colleagues from Manulife Financial Advisor. So a big thank you to all of you. Manulife Financial Advisor was established in 2015, and we are backed by our parent company, Manulife, which is based in Canada. Our objective is to be your full spectrum advisory firm. And to that end, we have forged strong partnership with some of the most distinguished life insurance companies. We have forged strong partnership with some of the most innovative investment platforms. And we have forged strong partnership with some of the most outstanding fund managers. We have close to 100 financial product solutions and investment funds for you to choose from and for us to work with you on. We want to be your advisory firm of choice. And to do that, we must meet your personal and business needs, ranging from health protection, family protection, personal accident, savings plans, investment planning, retirement planning, legacy planning, and on the business side of things, business succession planning, employee benefit, and credit protection planning. Last but not least, we will continue to work hard to engage you, to know you better, and to understand you better, so that you will give us an opportunity to be your preferred advisory firm of choice. In the meantime, tonight, please enjoy this session, and we look forward to seeing you for more of such events soon. Thank you.
Thank you, Mr. Wong. So now we will hand the time over to Dr. Chester and Dr. Jonathan. Really happy to have the both of you with us at this live webinar. Understand that there are rising concerns on men's health in Singapore. However, testosterone deficiency or TDS is something that goes unspoken most of the time. So Dr. Jonathan, could you share more on what exactly is TDS and how it affects the men in Singapore?
Sure. Okay. Thanks, Melly, for the kind introduction. It's a real privilege for myself and my colleague, Dr. Chester, to be speaking with all of you guys virtually this evening. So first and foremost, I think it's important to establish what exactly testosterone does. So testosterone is a hormone that is produced by the testicles, and it serves several important physiological functions in the body. So some of these functions include libido, which is our sexual desire. It also governs several aspects of sexual function. For example, it has an important role in erections, and deficiencies in testosterone can lead to problems with erectile dysfunction, otherwise known as ED. Testosterone also plays an integral role in the maintenance and building of lean muscle as well as bone mass. It's also an essential hormone in governing our energy levels. It regulates our mood and determines how we feel, and also gives us a general sense of well-being. And then certainly from a fertility point of view, sperm production is also another important function of testosterone. So do testosterone levels decline as we grow older? And I think this graph really encapsulates the decline that we experience in testosterone as we increase in age. So from this graph, we can see quite clearly that in our early 20s, all the way until about the age of 35, this is generally when most men will experience peak testosterone levels. However, once we cross the 35-year-old threshold, as we increase in age, the levels of testosterone does tend to fall over time, and the decline gets more and more marked as we age. So a gradual decline is generally seen beginning after the age of about 35, with a more marked decline seen in our advanced years. So for example, once you hit around the age of 80, this is when testosterone levels really tend to drop off. There was a big study that was done, and it found that in men between 40 to 79 years of age, testosterone concentration fell on average about 0.4% per year. So the decline is gradual, but by the time you reach your advanced years, it does become quite significant. So what are some of the symptoms of testosterone deficiency? So some of the symptoms that may prompt a man to be concerned about low testosterone includes a loss of libido, which is sex drive. Another common symptom of testosterone deficiency is erectile dysfunction. So problems with sustaining erections, maintaining erections, and so on. Men with low testosterone may also experience a decrease in spontaneous or morning erections. As testosterone levels continue to dip, men generally also experience increased fatigue, as well as reduction in energy levels. It can also affect the mood. So a depressed or irritable mood may also be one of the symptoms of low testosterone. And finally, men may also find difficulty with putting on lean muscle mass, or they may even experience weight gain.
So thank you, Dr. Jonathan. That was very informative. Can you tell us a little bit, okay, with all the signs and the symptoms that you mentioned, where should the men go to get themselves tested, and what are the tests that is required?
Okay, so that's an excellent question. So testosterone deficiency syndrome, or TDS, is diagnosed really based on two main criteria. So first and foremost, the men have to have symptoms of testosterone deficiency. That's going to be the most important thing. In addition to that, once we suspect a patient has TDS, we then perform simple blood tests. And these blood tests, we are essentially looking for laboratory evidence to confirm low testosterone levels. We do this oftentimes in conjunction with some other proteins in the blood, as well as other hormones that all govern the testosterone axis. Importantly, the blood draw for testosterone is typically performed in the morning before 11 a.m. And this is because of differences in the hormonal levels that vary throughout the day. So aside from TDS, there are several other conditions that may mimic the symptoms. Some of these conditions include problems with the thyroid. So the thyroid is a gland that's located, as you can see in the image, is located in the neck in front of the windpipe that transports air from the outside to the lungs. Other conditions include elevations in the levels of prolactin in our body. So prolactin is a hormone that is produced by the brain. If the hormonal levels of prolactin are too high, this can also similarly lead to problems that mimic the symptoms of TDS. Certainly, we can't forget the chronic diseases that many patients in our country face. Some of these conditions include diabetes, which is a condition of high blood sugar, hypertension, which is high blood pressure, as well as high cholesterol levels. A combination of any one or all of these conditions, especially if they are suboptimally controlled, can also lead to symptoms that are very similar to that of TDS. We can't forget mood disorders. So mood disorders, psychiatric conditions, mental health conditions like depression, these conditions can also mimic TDS. And finally, psychological factors. So if there's stress, if there are relationship issues, all these can lead to symptoms that are very similar to that of TDS as well. So important not to miss that out. So aside from all the symptoms that I mentioned, TDS has several complications that can affect a male. So from the same study that I mentioned previously, this was a landmark study known as the European Aging Male Study, otherwise known as the EMAS. It was found that patients with reduced testosterone levels had a variety of other medical complications. So some of these complications include a reduction in the red blood cell count. This condition is known as anemia, which can lead to fatigue and just generally not feeling very great, especially if the hemoglobin or the red blood cell count levels drop really low. In addition, it was found that men with TDS in general also had a lower bone mineral density. This is otherwise known as osteoporosis, and it can lead to certain complications such as an increased risk of fractures or fragility fractures, to be precise. Men with low testosterone generally also have a reduction in their lean muscle mass. These men often also report weight gain. They may feel that their waist circumference is increasing and that they're putting on more fat and having difficulty gaining lean muscle as well. Men with low testosterone, especially once levels hit a really low level, they tend to be just in general poorer health. They may tell us that they don't feel very good or they just don't feel right. And this could be one of the contributing factors, low testosterone. And I think importantly, especially in this day and age where we have advanced medical care and people are living to a ripe old age, it's important to also remember the potential implications that low testosterone can have on other systems in our body. And this includes something that we refer to as metabolic syndrome. Metabolic syndrome is essentially a constellation of different diseases and conditions like obesity, high blood pressure, high cholesterol, diabetes. And all these things are, really essential cardiovascular risk factors. So if you have low testosterone, that is a cardiovascular risk factor. You may be at increased risk of these conditions, and you may be at increased risk of heart disease as well.
So thank you, Dr. Jonathan. All right, so you can continue to input your questions. We'll be taking more questions at the end of the session. Now we'll move on to Dr. Chester. So Dr. Chester, how exactly can we address and manage patients with testosterone deficiency?
All right, so carrying on from Dr. Jonathan, how do we treat testosterone deficiency syndrome? We treat the low testosterone by topping up the testosterone. So this is what we term as TRT or testosterone replacement therapy. And there are a few ways in which we can bring up the testosterone levels. So as you can see from the slides over here, there are oral medications, there are topical medications, and there are also injections that we can give patients. So the oral medications are in capsule forms, and they usually are taken anywhere from 1 to 2 times a day. And the dose is really dependent on what the initial testosterone is and how much we're trying to bring it up by. There are also topical medications in the form of patches where you stick it onto your skin and you leave it on, and then after X amount of time you take it off. There are also gels which you apply usually daily in certain areas of the body. But from our clinical experience, usually for gels, in Singapore's weather can be a little bit uncomfortable because it tends to get a bit sticky. There are also injections as well, and in fact, for most of my patients, we usually use injections. And for injections, there are the short-acting ones and the long-acting ones as well. So how frequent do we inject patients with short-acting testosterone? We can inject anywhere from 1 to 2 times a week. And for long-acting, usually anywhere from about 10 to 12 weeks or so. And there are differences between short-acting versus long-acting sort of testosterone. And how we decide between short-acting versus long-acting is really dependent on the patient's preference, whether or not he has enough time to do it himself, whether or not they are afraid of injections, how low the testosterone is in the first place, whether or not cost is a concern as well. So we will discuss all of this with the patient to try to find what is the best solution for them lah. It's also important that when we raise the testosterone level, we don't forget to address some of the other things that Dr. Jonathan has mentioned also. So, in fact, I think the single most common reason why patients present to us and we find out they have testosterone deficiency is the first thing over here, erectile dysfunction. That could be the initial complaint when patients come in. They'll say, "Hey, doctor, I'm having issues with the strength of my erection, difficult to start, difficult to maintain the erection." And from there, we can do further testing. One of the testing that most doctors can consider is actually to see whether or not the testosterone levels are otherwise low. So besides treating the erectile dysfunction with things like PDE5 inhibitors, phosphodiesterase 5 inhibitors, things like Viagra, Cialis, Levitra, that is always done in conjunction with trying to raise the testosterone level. When we raise the testosterone level, plus we give these medications, it usually helps quite a bit with the erection issues. A lot of times, my patients, when they come in, they usually come accompanied with their wives as well. And most of the patients will say, "Hey, doctor, my wife is saying that my mood these few days is very bad." So we also have to address and discuss with them what is actually causing the mood issues. Whether or not there's any social factors. Are they having stress from work, from relationship? Maybe their kids is causing them a lot of problems. So we usually try to find out a bit of social history and try to advise the patient as appropriate, because it's not just low testosterone, give testosterone, everything will get better. We, as part of holistic care, we always want to make sure that the social aspect of the patient's life is also well handled. As Dr. Jonathan has mentioned also, there are some cardiovascular risk factors that people with low testosterone tend to present with as well. And they include things like diabetes, high cholesterol, high blood pressure. And if you are having these conditions, it is important to control this as well as testosterone, raising the testosterone levels as well. And we'll always encourage our patients to live a healthy life and exercise more, reduce smoking / cut off if the patient has a history of smoking, and stress from any form, emotional stress especially. That is something that we always try to help our patients with.
Dr. Chester, can I just ask, are all patients suited to be treated with the testosterone therapy that you mentioned earlier on?
So not every patient is suitable for testosterone replacement actually. Okay, and the reason is because testosterone does have its side effects as well. So any patient with a history of, for example, prostate cancer, breast cancer, or liver cancer, they are a definite no-no when it comes to testosterone replacement. Okay, for patients who want to preserve fertility, okay, we sometimes don't give testosterone directly. We'll address this bit in a little while. Certain hematological conditions. So, for example, if a patient has a very thick blood, certain types of blood cancers, for example, or if they are for example, a condition known as polycythemia rubra vera, it's a condition where the blood is very thick. These patients cannot, because actually testosterone, one of the side effects, which we'll get to later, is it can actually cause thickening of the blood. For any patient with severe heart failure or heart disease, late-stage liver or kidney disease, it's also a no for them. If you have very bad obstructive urinary symptoms, things like difficult for you to start urine, difficult for you to clear your bladder, or keep waking up at night a lot of times to go to the toilet, this is what we call nocturia. These are urinary symptoms, and they could indicate that maybe you might have a bit of a prostate issue or enlargement. If it's untreated and the symptoms are severe, we may want to deal with that before considering testosterone replacement. If your blood pressure and cholesterol are not well controlled, that is also a relative contraindication, because testosterone, when we give, sometimes it can increase the blood pressure a bit. It can cause your cholesterol to go a little bit haywire as well. And also, if you have severe OSA, which is obstructive sleep apnea, If you are not treated well, this is a contraindication as well, because testosterone can sometimes cause the neck tissue to become a little bit thicker, which may worsen your sleep apnea. So the goals of treatment, we talked about how we treat, we talked about the surrounding issues that we also have to address. There is a goal that all doctors would have to have when we treat the patients. And for myself, the first and foremost, most important thing is for my patient to feel better. Okay? If you give the medicine, the patient doesn't feel better, it could be a few things. Number one, maybe it's not testosterone that is low that's causing these symptoms. It could be the mood issues, it could be poor health, it could be social issues, it could be other metabolic issues which is triggering these symptoms. So if the patient doesn't feel better, we have to start searching for other causes as well. And also, we are always trying to achieve a normal testosterone level. So we're not trying to get too high, not trying to get too low either. So like Goldilocks like that lah, not too hot, not too cold. So that's the main goal of treatment. So there are some side effects, we've covered some of them already, but these are some other side effects that we can just quickly go through. They include things like local effects. It's an injection that most patients would go for. So when we inject the backside, of course there can sometimes be a little bit of pain, little bit of bruising in the area for some people. There can also be issues with acne or oily skin, hot flushes. There can be some mood change as well. Okay, there can be thickening of the blood. There can sometimes be mild fluid retention where you get a little bit of swelling of the ankles for some patients. Some patients, if their urinary symptoms may worsen if they have any pre-existing prostate issues as well. Okay, so we always have to screen for all of this before we initiate testosterone replacement. Some other not as common things will include things like thinning of the hair, sometimes breast tenderness as well. Okay, and the last part over here, which is infertility. So Dr. Jonathan previously did say that testosterone has a very big impact on fertility. So why is it I'm saying that when we give testosterone, the fertility may actually decrease? Which brings me on to my next slide, which is this thing over here. I know it's a bit chim. I'll just quickly go through. It will make sense in a while. Okay, so this over here is what we call the hypothalamic pituitary gonadal axis. And a bit chim, so I apologize. But after I explain, it will all make sense. So there's this part of the brain called the hypothalamus. Okay, it produces a hormone known as GnRH, which is gonadotropin releasing hormone. This hormone goes to another part of the brain called the pituitary gland to produce two more hormones known as LH, luteinizing hormone, and FSH, follicle stimulating hormone. And these two hormones then go to the testes to cause your testes to produce sperm and testosterone. Okay, so testosterone actually has what we call a negative feedback mechanism. So this minus over here is a negative feedback mechanism. What it means is that as testosterone starts to go up, it tells your pituitary gland that, hey, don't produce so much of this, don't produce so much of this as well. So by extension, if we were to increase testosterone in the form of injections, oral medicines, patches, etc., as this starts to go up, your brain will reduce the production of these two hormones over here. And when we reduce the FSH, the sperm will actually be lesser. Okay, so this is how giving testosterone directly can actually result in a bit of infertility issues because the sperm production will decrease. Okay, so we'll touch a little bit more on this slide later, but yes, this is why I said that there is sometimes certain issues with infertility with giving testosterone. So let's say for example we were to start patients on testosterone, there are a few things that we'll monitor. It's not we give one jab and then the patient disappear. We will usually call our patients back to see them in the beginning relatively more often, maybe every 8 to 12 weeks or so. But if it's more stable, we can usually extend the follow-up appointments. And in the monitoring, in the history taking, we'll usually look for the improvement of symptoms, improve in sex drive, sexual function, how's your erection like. We'll want to check on how the mood has increased. Want to check on your energy levels as well. So most of my patients, when they come a couple of weeks later, they will tell me that, hey, doctor, changed man. I suddenly feel that I have a lot more energy, my motivation has increased, my work performance at work and socially has improved. So this is the exact sort of picture that we want to hear. Okay. We also like to check with the patients on what kind of side effects that they have, as mentioned in the other slides. And we will usually do a couple of blood tests as well. No? So we'll do some hormonal levels. We also want to check how thick the blood is, that's known as a hematocrit. We also want to check this thing called PSA, which is the prostate-specific antigen. We'll talk on why this is necessary later on. And we also want to do a prostate check. Okay. We also want to check cholesterol about once a year at the very least. We want to see how the patient looks and feels, and want to measure their BMI as well. Most patients tend to lose a little bit of weight in terms of body fat, and they tend to gain a little bit of lean muscle mass as well if there is regular exercise in conjunction with the testosterone replacement. General health screenings should always be considered for people, especially of 40 and above. Okay, and sometimes certain doctors will also consider doing a bone mineral density. So Dr. John did mention that osteoporosis is one of the problems of low testosterone. We want to see whether or not giving testosterone has actually improved any of these bone markers.
So, Dr. Chester, we have a couple of questions from the ground, okay, from our attendees. Perhaps we can go to the questions first before we continue with your sharing.
Okay.
All right, so the first question that we have from our attendee is that I am 32 this year, I'm married, but have issues sustaining erection or even getting erection. So I do have the urge to have sex. However, my wife says that my down there have issues. So the question is, can you get, or can one get, okay, erectile dysfunction at such a young age?
Oh, do you want to take the question?
Sure. So, so thanks a lot for the question. So, I think the short answer is yes. Essentially, this can occur really at any age. It's not restricted to a specific age group, even though it is more common as one grows older. Even men in their late 20s or in their early 30s can have issues with erectile dysfunction, of which one of the causes is low testosterone. So, if that's something that you're struggling with, if there are other symptoms such as problems with sex drive, problems with morning erections, then certainly a testosterone test would be useful to see if TDS is the driving contributing factor behind the symptoms that you are experiencing. And of course, if that level comes back as normal, then there are all the other causes that may potentially mimic TDS that you may want to explore as well. So excellent question. I think a good take-home message is that essentially this can occur at any age. It's more common certainly as one grows older, but just because you are relatively younger, it certainly doesn't mean that you can't have low testosterone. Yeah.
So that means that the person who's asking this question should get himself tested if he is suffering from TDS?
Yes, so if he's having issues with erections, and especially if there are other accompanying symptoms, like problems with sex drive and so on, then I think certainly a testosterone test would definitely be very beneficial.
Yeah. Okay, thank you, Dr.
I'd just like to add on to that also. I mean, for TDS is a particular condition, and one of the symptoms of TDS can be erectile dysfunction. But erectile dysfunction itself can have many other different reasons why they may have as well. So as doctors, we always try to find out, could it be psychological issues? Maybe he's not well rested. Maybe he is very stressed out at work. Maybe he's fighting with his wife. So all of these kind of things are things that we want to discuss with the patient to try to find out whether or not there are other things that are contributing to this ED. But having said that, yes, if you have ED plus a couple of other TDS sort of symptoms, definitely a testosterone test is very useful.
Okay. Thank you, doctors. Okay, so we have another question. So our attendee would like to ask, okay, so if he has this thalassemia, okay, and he wants to find out if he is more at risk of TDS. Any of you would like to take this question?
Yeah, so thalassemia is a condition where the blood cells are not completely normal. There is no link between thalassemia and testosterone deficiency if a person wants to the short and sweet answer. Having said that, if a patient with thalassemia, if the blood count gets a little bit too low, they can present with signs of anemia, and signs of anemia can sometimes mimic testosterone deficiency in terms of feeling very tired all the time, feeling very lethargic, maybe even giddy. So not directly related to testosterone deficiency, But this is something that we will want to take note of as well lah. If a person has the thalassemia is not so good lah.
Okay, all right. So one last question: what are your thoughts on natural methods such as weightlifting, better diet to avoid the side effects?
So the side effects, the honest truth is there's not very much that you can do to avoid the side effects. Everybody's body responds to the medication differently. If you are one of the patients who have side effects, then there's really not much that you can do to try to counteract that lah. Having said that, not everybody gets side effects. When you look at the box of Panadol and then they'll say, hey, 20 different side effects. Most people take Panadol also don't have side effects. So similarly, not every medication, when we talk about side effects, means they will definitely have side effects. More often than not, most patients don't actually have. And in fact, that's the reason why we were talking about this monitoring slide. We are not trying to get a patient from low to super high. All right? We're trying to get the patient from low to normal. And when we increase from low to normal, most patients will experience an improving quality of life as compared to very bad sort of side effects. Having said that, in this question also, talking about weightlifting and better diet, weightlifting and better diet is also one of the core treatments for low testosterone level, because we do know that patients who are very unhealthy, who don't exercise, who eat a lot of processed foods, very stressed out at work, they're all associated with a lowered testosterone as well.
Okay. Thank you. Thank you, Dr. Chester, for clarifying on this question. So we can then move on to your sharing. We will continue with the slides.
Okay. So then a lot of patients, after we start them on treatment, they will ask, so doctor, how long do we have to continue on testosterone? And the answer is not easy to, it depends on every patient. We, for some people, start them for short term, maybe 3 to 6 months. And within these 3 to 6 months, if they lose a lot of weight, they change their lifestyle. When we sometimes take off the testosterone, the natural level of testosterone is enough to make them feel not so bad. Okay, but most patients actually end up with long-term treatment of testosterone because more often than not, when we stop the testosterone, it just goes back to what it was initially. So most patients would go on for long-term / indefinitely. Case in point, I had a patient before the whole COVID situation. I still remember very vividly. He's a European gentleman, and he is in his 80s, and he walked into my clinic and he requested for a shot of the testosterone. And I asked him, hey, so how long have you been on testosterone? And he's been on testosterone for 40, 50 years, even more than how long I've lived. So yes, testosterone can be given for an extended period of time. Some people also do decide that they want to cycle on and off. When we talk about cycle on and off, means we go for a period on testosterone, then a period off testosterone. That is also a possibility. But having said that, most patients end up doing long term. Okay, so we talked about fertility issues. This was the slide that we showed previously. And one of the questions that I usually ask my patients is, have you completed your family? So if it's a gentleman who has completed his family already, or maybe undergone a vasectomy, or wife closed shop already, then testosterone, no problem. We can give direct replacement of testosterone. But sometimes there are young patients who come to us and we test the testosterone, and the testosterone is otherwise low. Even patients in their 20s, even patients in their 30s. There is an option to actually treat testosterone deficiency without using testosterone itself. So remember this graph over here, where there are these two hormones known as LH and FSH, and these two goes to the testes to ask your testicles to produce more testosterone. So instead of giving testosterone directly over here, what we can do is we can trick the brain into producing more of these over here. And then they'll go over here, and then they'll increase their testosterone. So that is sort of like an indirect way to increase testosterone. So that is something that can be done with certain types of medications. But yes, this is usually more relevant for our younger sort of patients. Whether or not you want to treat with direct replacement of testosterone or indirect replacement of testosterone is really dependent on, as mentioned, whether or not you've completed your family, whether you want to preserve fertility. It's also dependent on whether or not you have any contraindications for any of the medications. Yeah, but in general, the giving direct replacement of testosterone, we are able to raise the levels much more. and most patients will feel more of the effect with a direct replacement. Okay, so the reason why I was talking about prostate issues just now was because there are some controversies with testosterone replacement. If you read online, Google, the two most common things that people are arguing about in terms of the scientific community is, number one, is it good or bad for the heart? And number two, does giving testosterone cause prostate cancer? Because we do know that the prostate actually does enlarge a little bit with testosterone. So the jury is still out, but in terms of the heart issue, we do know that low testosterone level is actually associated with heart issues, especially things like diabetes, cholesterol, high blood pressure, and also ischemic heart disease as well. So too low, not good. Too high, also probably not good. So most of us would err on the side of caution and say that if you have a history of severe or late stage heart disease, maybe testosterone is not for you. Okay, the second thing is, does it cause prostate cancer? If a person has pre-existing prostate cancer, then definitely no, we cannot give testosterone because it will accelerate the growth of the prostate cancer. But if we do the testosterone level, and we also do another blood test called the PSA, the prostate-specific antigen, and if the PSA is not markedly elevated, and when we start testosterone, the PSA doesn't increase up and up and up, then it probably means that the person doesn't have prostate cancer, and at the same time, it is probably going to be safe. Yeah, so does it cause prostate cancer? It can accelerate the development of any pre-existing prostate cancer, but no, it doesn't cause prostate cancer per se.
Okay, so doctor, are there any resources that people can learn more about this testosterone deficiency?
Okay, so there are some resources that we have put over here. So one of the resources which is very good is this website over here. It's dtapclinic.com. And in fact, I've written some of the articles over here, so you can go and check it out. And you know, a lot of times when you read up a lot about it online, some patients may get a bit of misconceptions. So even though you may read up online, actually the best thing for you to do is probably to also speak to a doctor about it. And there's also another resource over here, which is tackletdasia.com. So TackleTD is short form for Tackle Testosterone Deficiency Asia.com. And over here on this website, there's a lot more information as well. There are also certain scores to see whether or not you have any signs and symptoms and how bad the symptoms are, whether or not you should seek medical attention. So all these scoring systems are available on this website over here as well.
Okay.
All right.
Thank you, Dr. Chester. So we have a few more questions from the audience. We'll start with the next question. If one encounter ED, erectile dysfunction, at a young age, as per the first question, should one seek to purchase Viagra or this Tonka Ali immediately before seeking proper medical treatment? So, Dr. Jonathan?
Okay, so I think this is quite a common question that we encounter in clinic when patients come with erectile dysfunction. So Viagra, I think it's a name that most people are familiar with. Viagra is essentially a medication that increases blood flow to where it needs to be prior to sexual activity. It allows a man to achieve and to maintain an erection better. Viagra treats the symptoms of ED. It doesn't treat what the underlying cause may be. So there are many causes of ED, and of course, which is what we've talked about for the past 45 minutes or so, low testosterone is one of the causes. If you have low testosterone, Viagra can certainly help with the ED, but it doesn't treat the underlying testosterone deficiency. So like Dr. Chester alluded to earlier, if you have low testosterone and you have ED, we will treat you with both testosterone and medications like Viagra. They serve different purposes, they treat different things, but ultimately they address the symptoms of ED, which is a potential symptom of TDS. Tonka Ali is a sort of like herbal complementary kind of supplement that some people take to boost testosterone levels. As far as I'm aware, it hasn't really been clinically validated in any studies, but you know, if people find that it helps, then go for it. But otherwise, again, like Viagra, it doesn't necessarily treat the underlying condition.
Thank you, Dr. Jonathan. So the next question, I think
I would
it
just
is
like to add on
okay,
that
sorry.
also. So, I mean, for a lot of our patients, it's quite common they're asking us whether or not all these traditional medications they can actually try in conjunction or rather together with the Angmo medications the Western medicines that we usually do as doctors. And as what Dr. Jonathan said, you know, if it doesn't cause any harm, if there's no major contraindications, I usually do encourage my patients to do that as well. Dr. Ali, you know, from the scientific point of view, while some studies have shown that there is some small improvement, other studies have shown that not much of a difference lah. But having said that, Dr. Ali is also one of the supplements that actually has been shown to slightly decrease your this thing called SHBG, which is sex hormone binding globulin, and that in essence helps to free up some of the testosterone available to the body. So there's total testosterone, which is what all doctors usually use, and of this total testosterone, some of it is bound to certain proteins in the blood, and this sex hormone binding globulin is one of them. The thinking is that if you reduce the amount of things that bind to testosterone, it frees up more for the available for use for the body. That's called free testosterone lah. So that may actually help a little with your sex drive. That may help a little bit with your erections as well lah. But still more research has to be done in order for us to say definitely Dr. Ali will help with your erections lah.
Thank you for the add-on. Okay, so for our audience, you may continue, okay, to input your questions for our doctors. All right, so how you can do it is via the Q&A button at the bottom of your screen. You can actually send across your questions anonymously, and we'll answer them accordingly. Okay, so I'll move on. All right, to the next question. So our attendee wants to ask, okay, I have ED, okay, then should I check my testosterone levels? Dr. Chester, would you like to?
Yes, yes, you should. Yeah, but as mentioned previously also, you know, more than just checking the testosterone level, we also want to make sure that there are no other causes lah, which are contributing to this ED issue. Because there are many a times where we see patients with erectile dysfunction, even if we give replacement with testosterone, it may not necessarily cure the ED also. So if there are other things that are contributing to the ED, that is something that we would have to address also.
Okay. Anything to add on, Dr. Jonathan?
Yeah, so I think like we've spoken about, ED is primarily a symptom. Oftentimes people confuse ED and testosterone deficiency. They are interlinked, but they're not the same thing. Low testosterone is one of the causes of ED. So if you have ED, there's usually no harm in getting your testosterone levels checked, but I think the urgency or the need to check it is even greater if you have other symptoms. So things like low sex drive, if you have a problem with a loss of morning erections, a loss of spontaneous erections, and of course all the other symptoms of TDS that we have discussed. So things like lower energy levels, depressed mood, weight gain, difficulty building lean muscle mass. If you have these constellation of symptoms in conjunction with ED, then all the more you should go ahead to check your testosterone levels. Yeah.
Okay. All right. So the next question, I am trying to have kids with my wife. Should I proceed with the testosterone therapy?
So I'll take this.
Sure. Yeah.
So for testosterone, if we know that if we were to give testosterone directly, it's going to cause your sperm count to drop. That is usually the case. So if you are trying to have kids, no, we should not give testosterone in the form of injections, in the form of oral or patches, etc. We may want to consider trying the indirect replacement. Okay, or we can actually start the patient on some lifestyle change as well. So I did talk a little bit briefly just now about how unhealthy lifestyle, very stressful at work, you never exercise enough, obesity, fighting with wife too much. All these are all stress on the body. And any form of stress on the body actually is known to decrease the testosterone. So if we were to check your testosterone level, it's kind of borderline / a little bit low, it could be worthwhile maybe not to even start medications. We could ask you to lose 5-10 kilos, ask you to exercise a bit more, ask you to manage some of your social stressors a little bit better, and check, see whether or not the symptoms improve, see whether or not the testosterone improves. More often than not, in this day and age where everybody is so stressed out, even with lifestyle change, and if you lose 5 kilos, which I also need to lose, patients do feel better, and patients, it can actually see in the blood test that the testosterone does improve. Yeah, so not always necessary to treat with testosterone, but if let's say it is really very, very low and you're trying to have kids, we have to see whether or not we can try other methods instead of giving testosterone directly. We do know that a very low level of testosterone is also associated with infertility because remember the previous slides over there, if let's say there's low testosterone associated with problems of the higher hormones, for example LH and FSH, there could be other reasons why a person may be having difficulty in conceiving. So that is a whole different thing, a whole another section where we're talking about infertility as well. Whether or not which part is having problem, whether or not it's the sperm, whether or not it's the hormones, but that's another topic. Yeah. So speak to your doctor. Your doctor will be the best person to explain to you whether or not you are suitable for testosterone replacement.
Thank you, that's wonderful. Okay, all right, then anything to add on, Dr. Jonathan, or we can take the next question?
I think we can, maybe take the next question.
All right, thank you. So does the full health screening cover this testosterone testing?
So I think that's a common question patients ask. Patients come in saying that they did a health screen. Do they have to add on any additional tests? Generally, this is a very broad question, but it really depends on where you did your health screening and then, of course, what sort of package you opted for. In general, I would say that most of the health screening, at least the more basic ones in Singapore, it does not cover testosterone testing. This is usually a relatively specialized test that needs to be added on if you are specifically looking for low testosterone. And like we alluded to earlier, we don't often just look at testosterone in isolation. It's often in conjunction with a few other readings, other hormones, certain proteins in the body that bind to testosterone. And this gives us a holistic picture of the patient, all of which these tests are usually generally not covered as part of a usual health screen. So these are usually additional tests that patients would need to do. So do speak to your doctor about it, see if you're suitable, and if so, then this would probably be something that you need to discuss in terms of what exactly you are testing for after discussing with your physician.
For us at Dr. Tan and Partners, we do deal a lot with these men's health issue. So our health screening actually does have testosterone levels inside.
Okay. Good to know that, thank you. All right, so just now there was a mention about this prostate cancer, and then we have we have a question on asking whether this one can go for the testosterone therapy if he is on this prostate medication.
Okay, so I think that's an excellent question. As Dr. Chester spoke about briefly before, while testosterone replacement doesn't cause prostate cancer per se, it can certainly accelerate or unmask a pre-existing prostate cancer that hasn't been diagnosed before. So specifically with regards to prostate medication, I think it's important to see what exactly the medication is prescribed for. In general, a lot of patients are on prostate medication for enlargement of the prostate. This is a condition that is called BPH, and medications are taken to relax the muscles around the prostate and allow the patient to pass urine a little bit more smoothly. If the symptoms are very well controlled on medication, you aren't having issues with your urine flow, with your stream, with getting up multiple times a night, then yes, testosterone replacement would be suitable for you in the absence of any other contraindications. But if you are on medication for prostate cancer, you have active prostate cancer that your doctor has placed you on certain chemotherapy medications, certain anti-testosterone medications. That is something known as androgen deprivation therapy that is used in the treatment of advanced prostate cancer. Patients who are taking any form of these medications, if they have an active prostate cancer, then certainly testosterone therapy is a definite no in these groups of patients. So it really depends on what exactly you are being treated for and what the control of your condition is.
Okay. Anything to add on, Dr. Chester?
Yeah, I think one other thing is I think maybe we might have missed out in the slides. It's about the epidemiology. Yeah, so we do know that the older you get, the more common testosterone deficiency is. And more often than not, it's something that is very embarrassing for a lot of people to talk about. Even when patients come in, they also feel a bit paiseh themselves. Okay, but now it's people, as Dr. John mentioned, people are living a longer and healthier lifestyle. A lowered testosterone is associated with a poorer quality of life. So if you are experiencing any symptoms of low testosterone, okay, be it in terms of your sexual function or in terms of your mood or in terms of your energy levels, etc., it is worthwhile to actually speak to someone about it. Don't be shy, just come on in to speak to any doctor and discuss with them what can be done, because you don't have to live out the next 20, 30, 40 years of your life feeling not so great.
Yes.
That's good, yeah. I agree with that, okay. So, doctors, do you have any closing comments or any additional information that you'd like to provide for our attendees?
I think maybe something that myself and Dr. Chester would just like to share with everyone is that this is something in Singapore, at least in our local context, that often doesn't really get talked about or doesn't really get diagnosed as often as it should. So while testosterone deficiency in and of itself is not a common condition, it is certainly something that, from our experience, is underdiagnosed. And there are many men who, for a variety of different reasons, may not be aware that they have TDS. So either they don't know about the existence of the condition, or they are perhaps too embarrassed to seek medical attention if it's something like erectile dysfunction or problems with sex drive and so on. These are not symptoms that a lot of men can find it easy to talk about with someone. So I think the take-home message is really that if you have any of these symptoms that we've talked about today, even if it's just ED, I think it's definitely worthwhile to at least have a chat with the doctor to see whether or not you might benefit from screening for testosterone deficiency. Because aside from the symptoms that it causes you, the distress that it can cause yourself and your partner, of course, and your family, even if it affects your mood, your energy levels, and so on, it is by itself also associated with things like heart disease, with cardiovascular risk factors. So it's not a benign disease, it's not a benign condition. And there is certainly, like as Dr. Chester mentioned, very robust treatment that is available. So awareness is an issue, diagnosis is an issue, but hopefully with webinars like this, where we get to share a little bit about these conditions with patients, we can at least raise some awareness in our local context, and hopefully more of these patients who may be suffering from TDS come forward to get tested, and more importantly, come forward to get treated if needed. And that can really improve their quality of life significantly.
Agree, yeah. Early treatment is very essential. And what about you, Dr. Chester?
Good.
Good.
All good.
Thank you. Okay, thank you everyone. We have now come to the end of our webinar this evening. Thank you for joining us. We hope that the session was informative. It has been for me personally. So this webinar is organized by Manulife Financial Advisors and supported by Society for Men's Health Singapore. The Men's Health Hotspot, so we'll be flashing the screen later, okay, is for members of the public who are keen to find out more about men's health. So this channel is managed by the Society for Men's Health Singapore, and it offers health advice for the modern man. You can actually scan the QR code on the screen to access free online health talks on topics that may interest you. And for today's attendees, a representative from Manulife Financial Advisor may be in touch with you with more details on how you can redeem your free thank you gift from us. So once again, we thank you for joining us this evening. We hope you have a good night, and we'd like to see you again in our next event. So goodbye for now. Thank you.
Thank you.